Hi there, Dr. Darrow.
Hello, Nita Valens. How are you?
I'm great. How are you?
I'm living it up.
Well, that's a good thing. We want our listeners to live it up. And how shall we get them to do this?
Well, the first thing is let them call the studio right now,
Okay.
and they can learn about how to heal their musculoskeletal pain. That's a big issue for a lot of people. It can be from sports injuries, arthritis, anywhere from the head all the way down to the toes. And I use regenerative medicine, stem cells and platelets, to do that. Simple injections, walk in the office, get injected, and walk out. How easy can that be?
Very easy.
And you've had it done. It worked on you.
That's right.
Hey, we got someone named Mark here waiting to talk. I don't want to keep him waiting. Mark, you're from Winnetka. You have a shoulder issue. What's going on?
I had unsuccessful surgery with the Veterans Administration, and they put me out to community care. And I've been talking to a couple of surgeons in the area, and everybody is, even at the VA, they were so heavily lobbying me to get a shoulder replacement.
Hey,
I had what I did was I went in because I had a little tweak at certain angles on my right shoulder, and I didn't want it to get worse. So I said, had them assess it. They told me there was a tear in the spinatus, I think you call it.
Yeah, supraspinatus. It's the most common tear of the four rotator cuff tendons.
There you go. And so I was told, minimally invasive arthroscopic surgery. It totally failed. Now I don't have range of motion at all in the right-hand side above the horizontal. It's orders of magnitude worse. So I went in and they sent me out to an outside civilian, as it were, medical facility. I don't want to name it and anything. But they also want to heavily, I had no symptoms of arthritis. It shows up on x-rays, yes. But my personal experience was negligible at most. But I come out of here and now they want, it's like they're almost trying to force me into surgery.
How long ago did you have your first surgery? Or did you not
It was in March of last year.
Okay, so
and,
it's about a year ago.
with the VA going through the system, it's almost glacial in speed. It's just lethargic and to get anything done. So finally I'm with community care, which is outside of their system.
Sure.
And they want to do shoulder replacement. And I said, look, it doesn't address the problem I had. Can you fix the surgery that pulled out? Apparently the muscle pulled out, or the supraspinatus detached. It had a tear in it, and they were supposed to mend it, and I end up having no use of it anymore. And I'm an athlete. Okay, I'm 68 years old, and I'm a high miles cyclist.
Okay.
So now I'm asymmetric when I'm on the bike, and I put 30, 40 miles in a day. Okay,
wow.
I'm a nut. Okay, one of my doctors said I'm a freak of nature, which was a kind of a fun.
Well, you want to be that. Sounds like a good thing. Sounds like that's a good thing because you're active.
Oh gosh, yeah. I'm very healthy. I haven't had a flu in over 30 years. Former Marine. I'm really into the workout. It's my time alone too. I'm a single father, so when I go out there and I'm sitting in the saddle for hours, it's my time. It's a lot of who I am.
May I respond to all of this?
Yes, sir. Please.
All right. So, I have a supraspinatus tear in my right shoulder. I also have a subscapularis tear in my right shoulder. I also have a labral tear in my right shoulder. The question is, do I have any pain? Do I have any decrease in range of motion? No. Did I before? Yes. My shoulder was locked up, worse than yours is. But I injected myself, and I used stem cells and platelets, and I'm all better. So I'm sorry you had that surgery. Unfortunately, our culture is to do surgeries when they're not needed. And I would throw out a make-up-believe number that 99.9% of the musculoskeletal surgeries that are done don't need to be done in order to heal, because we can now use more advanced techniques that are non-invasive, which is just injections of your own cells.
Yes.
And I think there's a high probability from what you're telling me that regenerative medicine of stem cells and or platelets could heal your shoulder. I haven't touched it yet, so I can't tell you anything for sure.
Yeah.
But just based on what you're telling me, I think it could heal. I had a failed surgery back in when was 1994, I think it was. Yeah, it was my last year of medical school, and I was doing orthopedic surgery, and I loved my professor. And I literally begged him to do my shoulder because mine was like yours. I had a tweak. Mine was from weightlifting. I didn't know anything back then. I was just like, surgery's all we did. So I was like, do mine now. And he did it. And mine came out much worse, very much like yours. Mine was all full of fluid, like a balloon, and I had a fever from it. And then I couldn't really use my arm for about 4 years until at my residency at UCLA, I learned about regenerative medicine, and I self-injected my own shoulder, and it healed the next morning. It was the most incredible miracle that I've experienced in my life. Now, it doesn't always work like that, Mark. I have to tell you, it doesn't always work quickly like that. Sometimes it takes several treatments to heal things up. And with yours being frozen like that, you'll need to start doing some stretches, which I can show you, to help get back that range of motion. That may be all you need. I don't know. I'd have to take a look.
They sent me to they sent me to a physical therapist at one point, and it didn't seem to have any efficacious effect.
Okay.
They do offer something called orthobiologic therapy. Is that the same thing, or something similar to T cells or stem cells?
I don't know what that means because it's one of those vague terms. Let me give out our phone number to get some other callers while I'm talking to you.
Sure.
So hang with me, Mark. If anyone wants to call in, the phone number right now to talk to me is 866-870-5752. That's 866-870-5752. And if you want to reach the office, there are people there now also that can answer other questions than what we're talking about. And the number to the office is 800-300-9300. That's 800-300-9300. And if you want to watch me doing these procedures to see if it's something you think you may want to do, you can just go to my website, which is www.jointrehab.com, www.jointrehab.com. And there's a spot there on every page where you can email me personally, too. And I respond to everybody's email every day. So I like to communicate with my patients. Every patient has my personal cell number. I get text all day and all night, and I get emails. I give my personal email. So I like to stay in very close communication with my patients to make sure their healing goes well. So let me look at some of these other things you told me. Number one, you said that they told you they're going to do a minimally invasive surgery. Well, there is no such thing. Anytime you have surgery, it's maximally invasive. Sure, they could have used an arthroscope to look inside and then put some small tools in, but that can do just as much damage or more sometimes than an open procedure. So the minimally invasive surgery to me is a bunch of bunk, okay?
Yes, sir.
The arthritis part means nothing. And an example is this. I had a woman who's an old friend of mine. I saw her at a party last Sunday, and she said, my back hurts. And I said, well, come up to this room. It was at someone else's house, and just lay down on the bed for 1 second and let me touch the area. So I touched the area and I said, it's your iliolumbar ligaments. They're sprained. And she said, no, it's not that. I've been told by 3 different surgeons that I need a hip replacement. And I said, well, okay, turn on your back. Now let me see what's up with your hip. So I moved her hip around. She has a little bit of decreased range of motion, which means she has arthritis, most likely. And then I said, let me see you walk. And she walked perfectly, no limp, no nothing. So I said, and she said, well, I have terrible arthritis. And I said, well, you don't have terrible arthritis. You have a little bit of arthritis because you still have decent range of motion. So she came into the office, and I thought I was going to treat her. And she said, no, I don't want treatment today. I just came in to show you my x-ray. And I said, I don't really want to see your x-ray. And she forced me to. We're old buddies. She said, I want you to see it. And I said, okay, it's not going to show me anything because my examination showed me what I want. So she showed me the x-ray. It's got arthritis in it. And she said, see that? That's what they showed me. It's terrible arthritis. And I go, it's not. It is arthritis. What's arthritis? In that case, it's just wearing down of the cartilage. There's plenty left. It's like a tire that has a life of 80,000 miles to it. I don't know if tires today have that, but they used to. And you're just down like 20,000 miles. There's still a lot of tread on your cartilage. And she got very exasperated with me, and she didn't treat, which is fine. And she'll be back, when she realizes that what they told her is that she's got to do the hip replacement to get rid of her back pain. She doesn't have any hip pain. Now, does that make any sense to you? It makes no sense to me, because she would have had a hip replacement that ended up, who knows what. Those turn out great sometimes and terrible sometimes. And then she'd still have back pain. So you go figure. I can't. And she was very upset with me because I'm not agreeing with her other doctors. So maybe she'll get a hip replacement. I hope she doesn't.
Doctor,
she sure doesn't need it.
Most of what I got, Doctor, was just non sequiturs, things that had no relation to, and vague replies that really didn't address my problems. And, I had no popping or ratcheting. I get this hideous ratcheting sound.
Yeah,
when
I hear you. But I still think it's possible to heal your shoulder in spite of the failed surgery, in spite of your lack of range of motion, and everything else. I wouldn't be able to tell you anything until I examine you.
Yeah.
When people say, look at my MRI, I go, my hands are my MRI. Your MRI is not going to really show me much. I like to see them, make sure there's no cancer or something terrible in there. But if a doctor's not using, their hands to examine and move the person around, they're not doing a good service. And unfortunately, most of the failed surgeries I say to the patient, did the doctor examine you? They go, no, they just showed me the MRI.
Well, West Los Angeles is a teaching facility also for a lot of youth.
I know. I worked there for 3 years. I know it very well.
And we're just walking around a bunch of old geezers, and I mean, seriously, I can't get a direct answer. It's always a deflection. And
let me tell you why that is, Mark, and I'm going to be really honest with you. Yes. And you have to understand that's just little old me talking, okay? I'm not the god of medicine. This is just my experience.
Okay.
Yeah. I've been doing this a long time, but I'm not the god of medicine. My experience is that doctors don't know a whole lot. I love doctors, and I especially love surgeons because their work is very difficult. But I find out every day that the medicine we learn is wrong.
Well, I try to take the path of least resistance.
And don't do that when someone's going to operate on you.
Well, I want to take the path of least resistance in my treatment, and going to a full-on...
Well, you want to be conservative in your treatment, meaning you don't want to be invasive.
So overly barbaric to replace... it's not even... I don't even think it's at all called for to replace a whole shoulder to address an issue that really had nothing to do with arthritis. You see,
listen, I'm with you.
I know you know what I'm talking about.
I am with you. You're preaching to the choir here, man.
Yes, sir.
I've been almost every day of my medical life, I am stymied by how ridiculous modern medicine is in many ways. Now, I'm not saying it's all terrible, because it's not. It helps people live.
Yes.
There's a lot of things that have to be done, but there's so much going on that just shouldn't be done. In my humble opinion.
They always want me to take pain pills. They're trying to push pain pills on me. And, I'm not going to get into the whole big pharma thing, but I just don't feel the need to take all these drugs they want me to take.
Well, it's not going to do you any good. I can promise you that.
Well, they want me to take some sort of anti-inflammatory. I forget what the name of it is, but...
anti-inflammatories wear down the cartilage more. There's studies on that.
Oh, yeah, I refused it. Yeah,
because number one, it blocks the inflammation that's needed for healing. People go, inflammation is needed for healing? Yeah, that's how the body naturally heals itself, through inflammation. So if you sprain an ankle and it's all swollen, do you go get a surgery for that? No. But if it's in the back or the neck or the shoulder or the hip or the knee, then you get a surgery. Why? I don't know why. I had mine on my shoulder. I'm not doing any more. Mine failed. Yours failed.
You think perhaps that with physical therapy as well, that might...
I don't know what to tell you until I examine you, Mark. It's just that simple.
Well, maybe I can get them to refer me out to you. I'd love
They
that.
won't. They were not going to refer you to me.
Oh, they won't? Oh, okay.
No. Nope.
Sorry.
I'm not a government affiliated association here. I'm just a private
Yes.
little guy on the street.
Well,
But I'll give you the phone number to the office. It's 800-300-9300. And if you want to watch the videos of me injecting shoulders, go to www.jointrehab.com. I inject the whole body. There's nothing I don't inject that has to do with the musculoskeletal system.
yeah, I pulled up your website and it looks great, the Joint Rehab, and I'm going to look at it myself and watch you proceed with the procedures.
And if you email me, I'll call you up.
Oh, splendid. Okay.
Yeah, I'll call you up and we can talk if you need more information.
Well, thank you for being there for us. We appreciate it.
Well,
I'm sure a lot of people out there.
Yeah. And thanks for your service as a Marine. We really appreciate that.
Oh, it was my honor to serve, and God bless you. Take care.
God bless you.
Thanks for your call, Mark.
So I'm going to give out the phone number to the studio right now. You can talk to us live, and that number is 866-870-5752. We love our callers, and Mark was a great caller. He had so much information.
He did.
About his failed shoulder surgery, and what is invasive versus minimally invasive, and what is arthritis, and things like that. The good news about Mark is he's still cycling. He's 68 years old, and he's cycling 30 to 40 miles a day. So Mark, God bless you with all that. Keep active. It's the biggest thing to keep us healthy. So Nita, you're chomping at the bit. What do you want to say?
Well, I just want to give the phone number and the website again.
Okay, it's 866-870-5752. Website, www.jointrehab.com.
Do you want to mention what else is going on in the office?
Why not? The things that we do to regrow tissue on the body, in the joints, ligaments, and tendons, we use stem cells and platelets to do that. We can also do that on your face. Whoa! How can you do it on the face? The face is made out of collagen. The whole body is made out of collagen. All we're doing is stimulating new collagen to grow. So we have something called the vampire facelift. Non-surgical, just some injections. We numb up the face and inject it and grow back the collagen, which is drying out as we age. Also, this can be done on the top of the head if your hair is thinning, to revitalize and rejuvenate the hair follicles and thicken up your hair. Cool, huh?
Very cool.
I love it.
I like it.
Let me take a question here, if you don't mind.
Let's do it.
Let me see what I got up my sleeve. This is a good one. Everybody who's interested in this term, you can Google it, and then on the upper left of Google, after you find the term, you can hit images, and you can actually see pictures of what I'm talking about. So this person says, I have a medial, that's middle, osteochondral lesion. They wrote legion, but they meant lesion. In the talus bone in my ankle, stage 3. Pain started 4 months ago. Many doctors advised microfracturing surgery. That means that you kind of chop up the bone a little bit in the cartilage.
Ouch.
It can work, but it's not creating great cartilage when it does that. In my experience, it's kind of a fibrocartilage, not the real thing. But I didn't do it as the last doctor I visited advised me to do physiotherapy plus hyaluronic acid injections every 6 months. He injected one injection in the ankle before 2 weeks, but now it's not feeling any good. Well, a couple things there. If we were to inject that area with the osteochondral defect with stem cells or platelets, the body automatically generates hyaluronic acid, which is a lubricant. You don't need to inject hyaluronic acid anywhere. Why take something like that and inject it when you can have the body stimulated to do it on its own naturally? In addition, we see a lot of people getting this, let's say, in their knees, and I take a look and there's a huge effusion. That's a big fluid deposit. Why? And that's hyaluronic acid in there already. Why is a doctor going to put more in there? Makes no sense to me, but usually what doctors do doesn't make too much sense to me. It's sort of the tradition of medicine. This is what we're taught to do. I know traditional medicine. That's how we're trained. But I was always bucking the system and getting yelled at for it by my superiors. But I kept doing it because they're things that I found that work better than traditional medicine in every aspect of medicine. And I don't care what field it is, cardiology, you name it. It doesn't have to just be orthopedics. There are things that could be done naturally in every form of medicine that are very helpful. I'm not putting down traditional medicine. It's just not the end all. It's the beginning. So what is an osteochondral defect? Osteo is bone, chondral is cartilage. So the interface in between those two can have a, let's say, a little crack, a little minuscule crack in it. And that can sometimes come loose. But in and of itself, many people have those and have no pain. So here's a guy or woman who writes this and says, I have osteochondral defect, I have pain. Well, that doesn't mean the osteochondral defect is causing the pain. Okay? So don't let anybody take that out. I treat people with them all the time. Don't get a surgery for it. I don't think you need it. But that's just my humble opinion. There's ways of healing that are very natural using stem cells and platelets. It's simple. Why would you go put a knife in something, cut it open, take things out, and then destabilize the area? I'm not for that. There are times it has to be done. There's no question about it. If you fracture your knee or your leg or your arm and the bone is sticking out of the skin, you better get to a surgeon right away. But most of these orthopedic surgeries that I see being done should never have been done. People come in every day with failed surgeries. I don't like that. I had one. I don't like it. Nita, you're breathing again.
Oh, I forgot. Excuse me. No, I forgot not to breathe.
You can hold your breath.
Oh, yeah. Like, there's a famous guy that does that all the time for like 10
Houdini?
and 20. No, after Houdini, like a guy that's still alive right now. I can't think of his name.
Is he the deep sea diver guy?
I think so, yeah.
Yeah, I've heard about him.
Yeah.
Pretty amazing.
So this is a complex case, this medial osteo ankle thing.
It's not complex at all. That's my point. It sounds complex.
Yeah, it does.
But is it?
No, not the way you explained it.
Well, it may be or may not be. If the piece comes loose, that's a problem. But if it's nice and sturdy in there, it usually is not a problem. One of the most common places to see them is not the ankle, it's the medial aspect of the femoral condyle in the knee, the middle part of the knee.
Ah.
And they're very, very common. I see them all the time. And it's not usually the cause of the patient's pain. We find that what I'll call serendipitously. We do X-ray or MRI or something. We see it there. But it's not necessarily even in the area where the pain is. So don't get tripped up because you have something. One of the most common things I see, people come in with degenerative disc disease and they say their surgeon says they need to have a back surgery, when it's not even the discs that are causing the pain. I see it all the time. People come in, almost on the verge of tears. I've got degenerated discs. How old are you? I'm 80. You're supposed to. It's natural. It's natural aging. Things dry out. We get shorter. Oops, the break.
All right.
I'm going to give out the phone number to call Nita and I right after the break. It's 866-870-5752. I'll repeat it, 866-870-5752. If you want to reach me at the office, the number there is 800-300-9300. God bless you. We'll be right back.
We will indeed, and this is Living Pain-Free with Dr. Marc Darrow.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.